So we've all heard the story, and maybe you even know somebody who's had this experience, but they had no idea that they had weak bones. They had no idea they had osteoporosis until, unfortunately, they had a fall, broke a hip, and it was downhill from there. So we've all heard these stories, and it's devastating and sad. But what if there was a way to determine if you are genetically predisposed to having weak bones? There is. There is. The genetics test that we do is amazing, and one of the genes or one of the variants that it looks at for people is something called VDR, which stands for vitamin D receptors. So we have these receptors on our cells that take vitamin D into the cells. Virtually every cell in our bodies have these vitamin D receptors. They're so important for immune function, but also for getting calcium into the bones. So we need those vitamin D receptors to be optimized. We need to have enough on each cell so that we can get that vitamin D into the cells. And fortunately, if you have one of these three vitamin D receptor variants, then you are going to be less efficient in getting vitamin D into your cells. But knowing that helps you know how to optimize your vitamin D. So if you did a genetics test, which the genetics test that we do looks at all three vitamin D receptors, if you look at those genetics, you can make changes early on in life. And I'm telling you, 100% of the people that have osteoporosis that have come to me have two or three of these variants. So knowing early, they would have changed maybe how they look at their vitamin D intake, how they look at what their levels should be, and we can help you adjust that according to what the studies show are the best and optimal levels for vitamin D. That's just one of the areas we look at for bone health. So optimize your vitamin D and let us help you figure that out with genetics.